Hello everyone, I'm Greg Moss with the Metro North Chamber of Commerce, and this is Health Watch, where we focus on what's happening in the healthcare industry, specifically in the northern part of town and the Metro North region. I'm honored to be joined by Dr. Stephen Cobb, who is the Chief Medical Officer for the St. Anthony North Health Campus. So thank you for joining us.
It's my pleasure.
And thanks for all you do at St. Anthony's North. It's an amazing campus. And just talk a little bit about this campus, about 3 years old right now. It was really established as a health campus.
That's right.
Not just built for medical service, but also to attract the entire community too.
I think that's right. So, starting with health, hopefully most of us are at a stage in life where we don't need a hospital. We don't need health care as it's traditionally thought of. And so the health campus was designed for the whole community. We have bike paths that are centered around our community, around our hospital, around our campus. We have a community garden that we just launched, and you were there.
I was there.
And my own family has a garden plot there, and so members of the community can grow healthy food and harvest it themselves. We have community groups that focus on, all sorts of healthy living that meet in our facility. So we really wanted to be a part of a healthy community and promote that.
Well, we appreciate your partnership with the Chamber and all you're doing for the community, and it's awesome to be able to host some of our events there too, which we'll let you know more about a little bit later on. But let's do focus on healthcare and specifically on primary care. I know you feel very strongly about that.
That's true.
You and I have talked about it in the past, but it's really a critical part to the whole system.
Yeah, it is. Primary care is sort of your entry point into healthcare. If you have a need, whether it's to stay healthy or you have a symptom that you need to explore, or if you have a chronic condition, generally you all start with primary care. And primary care physicians are trained so that they can take care of 90 to 95% of any issue that any patient would experience. But they're also trained to navigate the entire healthcare system and guide you through it. And so, primary care is essential to a healthy workforce.
And it's really an important part to the overall discussion of healthcare too, which we've talked about. And one of the questions you asked me before we went on camera here is, what do our members want to know? What does the business community want to know? And one of the first things we always hear is, my goodness, how can you help me control my healthcare costs?
Yeah, right.
And primary care plays a big role in that.
Yeah, I think that's true. It's easy when you experience a health event or a symptom that's confusing to you to go to a lot of different places and spend a lot of money that may not be necessary. And if you start with a good, talented, trusted primary care doctor, it's been shown in studies that you have a more efficient experience and still get the same great outcome.
One of the things I love about Centura as a whole and the system is it's always looking forward, it's always looking to the future and the trends around that area. And one of the things that you all are just launching right now on your campus is this convenient care clinic. Talk a little bit more about that.
Yeah, we all have busy lives and we have healthcare needs. And we want patients to be able to access us when they need us. And traditionally, after hours on the weekends, you have an urgent care option, you have an ER option, but you don't just have a convenient care option. So I know that when I was in practice in primary care, we had weekend hours for people so that they wouldn't have to take off work for their routine appointments. And then certainly if they had illness issues on the weekend, we were available. And so at the St. Anthony North Health Campus, we've established a convenient care clinic that's it's operating after hours, starts at 5 o'clock and goes into the evening, operates on the weekends. We want the community to be able to access us when they need us.
So is it really that bridge between the ER and perhaps critical care?
The hope is that it helps you avoid ER or even urgent care at a lower cost, but very high quality. And so, yeah, it truly is designed for the convenience of a patient.
You are seeing tremendous growth.
Yes.
As well. And one of the things that attracts growth is just having a good product.
Right.
And so I think that says a lot about your team, about the healthcare. Quality healthcare, I guess it goes without saying, is really at the core of everything you do.
Yeah, we measure just about everything that you can measure to make sure our quality is good. We have, for example, one of the lowest mortality indices of any hospital I've seen in the region. And so what that means is that we can look at the patient characteristics, what they came in for, and there is a predictive model of whether you'll survive the hospitalization. And St. Anthony North Health Campus performs much better than what is expected. So in 2018, we were awarded the Healthgrade's Distinguished Hospital for Clinical Excellence Award. And this is based on metrics. It's all on performance. It's not on processes that you have in the hospital. It's 100% on metrics, and that's in the top 5% of hospitals in the country. So
that's a big deal.
It is. We're humbled by it. We're proud of it, but we want to get better. We want to be in the top 1%. So we keep, using quality improvement science to make us even better.
Part of that is a great team.
It is.
I mean, I'm always impressed when I walk in that it's always a smiling face.
Mm-hmm.
There's always someone who's willing to walk me to wherever I need to go.
Right.
And it's not just one, I'm not being singled out. It's with everyone who walks through that door.
There are three pillars that are really important in healthcare. One is quality, which we've discussed, and one is the experience, which you're, I think, highlighting, in that when people walk in our facility, the entire campus is designed, the physical plant is designed to feel like a healing presence. And then the third piece, I think we talked about at the beginning, or at least we started to, and that is doing it for the right cost. And that's why I think primary care is so important. And access is so important. And that's where that convenient care clinic, man, it really helps.
You talked about being recognized for your quality care really from a national perspective, which is awesome. But I got to tell you, what really speaks volumes are when the EMS partners say, this is where I want to take a patient. And you've got some very strong EMS partnerships.
Yeah, we've really concentrated on that relationship. We all get better when we get feedback on our performance. And so when we have a patient that's brought in by an ambulance, let's say they had chest pain, for example, and they actually did have cardiac disease, and they would go to our cath lab for definitive treatment. Sometimes we'll bring the EMS staff back to watch so that they really understand sort of the continuum of the care that they initiated. So they are super important teammates.
And it says a lot that they're referring to you, because they know for sure.
But they do.
My last point that I want to kind of dive into more is this whole person health concept that Centura as a whole has really leaned into, but you're doing a great job at this campus as well. And it means a lot to people personally to get that kind of care, but it also has a bottom line impact too.
Well, I think it does. So when we approach patient care from a mind, body, and spirit perspective, there are all sorts of evidence-based therapies that are non-traditional. We often call that integrative medicine. So whether it's acupuncture or whether it's music, there's really good data about using music to alleviate pain. And with our opioid crisis in our country, anything that we can do to treat pain that doesn't involve opioids is helpful. Now we still have to use them in healthcare. So yeah, we have a number of modalities that are non-traditional to complement the really good traditional healthcare we do at St. Anthony North.
Well, congratulations on all your success.
Thank you.
And for the great work that you and the rest of the team do at St. Anthony's North Health Campus.
Thanks, Craig.
Thanks for being here for Health Watch, too. Dr. Stephen Kopp, Chief Medical Officer at St. Anthony's North.